Welcome back to the King's Podcast, The Wellness Dive with Lackie. I'm your host, Esther Lackie. Today we are joined by consultant breast oncoplastic surgeon, Dr. Rita A. She's here today to take us on a deep dive on why you should get yourself screened for breast cancer at the age of 40, or sometimes before, depending on the risk factors. Also with us, we have Lorena. She's a breast cancer survivor and a strong one at that. She'll be taking us on a trip down her treatment journey and her entire journey with breast cancer until the point she was declared cancer-free. So, Lorena, I'm going to start with you. The mammogram, it was the first ever you've taken in your life.
Yes, correct.
And it came back showing that you have breast cancer.
It came back showing that there was something unusual in my breast.
All right.
So Dr. Shirin, she sent me for a biopsy and an ultrasound to find out what it was.
What motivated you to get this first mammogram if you've never had one before age 40?
The fact that I turned 40.
Only 40?
Simply.
Only that?
Yes.
Now, doctor, why is it important for women to take mammograms seriously at the age of 40?
Exactly. Lorena is a typical example of the importance of screening, of early detection. Because at the age of 40, most of the studies have shown that we need to start the screening at this age. So she had the mammogram, and the mammogram showed abnormality that showed the cancer. And this early detection saves lives because it allowed to go ahead very quickly with the management, the treatment, whatever needs to be done, and get rid of it, make it like a chapter from the past. So screening is very important at the age of 40. Now, definitely the self-examination before the age of 40, every month after the period, we have to really consider this for every woman. But when we are 40, we really have to remember to start doing our screening mammogram.
Take it very seriously.
Exactly.
But then there are women who have risk factors, which means they can develop breast cancer before they reach 40.
Sure.
What are these risk factors?
We are detecting more and more younger, like cancer in younger ages. So this is why we insist on the self-examination in case something become palpable or any change. We need to check for any change in the breast, redness, change of skin, discharge, anything that has changed. Should alarm us to see the doctor. Now, of course, we have the biology is different from a person to another. Sometimes we have family risk. Sometimes we have things that happen before the age of 40. We have to check immediately with the doctor, which will allow to do the proper testing, the proper diagnosis. And if it is malignant, then definitely the proper management.
All right. Thank you, doctor. Now, Lorena, so when you went to do your first mammogram, did it occur to you that it might come back showing something sinister with your breast?
No.
So you were not expecting it? You're not expecting anything?
No. I never imagined.
So when the news was broken to you by, it was Dr. Rita, yes?
Yes, Dr. Rita and Dr. Hassan.
What went through your mind?
Many emotions. It occurred to me that we are so fragile. You are very healthy one day, but something so small and so simple can happen to you a minute after. So we cannot take anything for granted.
So, doctor, when you're breaking this very difficult news to your patients, actually, how difficult is it? And I can imagine it's very emotional. I mean, you have more than 2 decades of experience dealing with this.
But every time is a different time, and every time is a challenging time. But we always have to walk. It's not just like suggesting, giving a diagnosis. You have to have the surgery, you have to have the treatment. It is walking through this pathway with the patient. So we start, this is the way I feel it, like hand by hand, we sit down, we start to explain, try to get the medical explanation, and then give like surrounding plan how we go through this. Sometimes we cannot arrive through this through one explanation. The patient, especially at 40 and even younger most of the time, healthy. She's like, I'm healthy, I'm exercising, and this is the words of Lorena. I'm healthy, I exercise, I'm doing everything as like supposed. So how come? How come it happens? So as a doctor, you need to find find a way how to explain this, that sometimes we don't have an explanation why it's happening, but now we need to work together to deal with what is happening so we can make it a chapter from the past.
So, what stage of the cancer was it?
1.
Stage 1. That's
Early.
That's
This is
early.
early, and this is what sometimes
you're
what
fighting.
exactly what I tell them in the bad luck. Sometimes this is a good luck, because the purpose of screening is to detect very early breast cancer so we can try to get rid of it.
When you first got the news, who was the first person you called? Your support network, how did it go from there?
Here in Dubai and maybe many countries where you work, but especially when you are far from your family, your colleagues
Yes.
become your family.
Mhm.
So I'm very lucky, and I have very close colleagues who are my friends and my family. They were with me when I was diagnosed.
And I understand your company was such a big support for you.
Yes, the company supported me with everything, with insurance, with anything that I needed. They were there.
That's very good of them.
Yes.
Yeah. And might I ask, is there a history of breast cancer or any cancer in your family? I mean, what led to this?
I have one aunt who suffered from breast cancer, but that happened only a few months before. But after that, there is no history of breast cancer in my family.
So, doctor, the statistics for breast cancer running in the family are quite low. Actually, 85% of all breast cancer
Correct.
that develops
Correct.
is not
Correct.
as a result of family history.
Correct. Sometimes we have breast cancers indeed related to family history. So, again, another message we highlight enormously is to share with the doctor our history. Because if we have 3 and above family history of breast ovarian cancer, if we have somebody at the age of 30 who had breast cancer in the family, or somebody like a male, breast cancer can happen to men as well.
What's the percentage of that happening to the males?
It is like it is very low as well, but it can happen. So if you feel a lump and you're a man, you should also consult the doctor. So when we have those family risk, it should be highlighted to the doctor, because we need to dig for family history, mutation in the genes, and then recommend the prophylactic. But not all the time it is related to family history. We have a lot of examples like Lorena where it happened without a strong family history. So this, to what it is related, we are not sure yet, but we insist, like we try to implement and encourage people to get away from the factor that put us at high risk, either the lifestyle or the cigarette or not exercising, which is not the example for Lorena. So when we say factor high risk, it doesn't mean if we don't do that, you will have cancer. It means that the risk is
for Lorena, you did everything right. You ticked all the boxes, but you still had the lump.
I didn't have the lump. I didn't feel.
You didn't feel it. It showed on the.
It was hidden.
Yeah.
Hidden somewhere. But still, with you ticking all the boxes of living right.
Yep.
It still came.
Yeah, because
So
the
it can just
biology,
happen.
exactly. So this is why we are highly, highly insisting on the starting the mammogram at 40, even if we do not feel anything.
What if somebody, let's say, they want to do a mammogram at 20?
So far, so maybe in the future, if the guidelines are with all the data, all the findings we are working on, they will come up with updated. It will maybe be another test, because to be honest, yes, we are detecting breast cancer at early ages. Studies and research everywhere, like they are working on finding new markers, something that will help us to detect the cancer before or the risk of cancer before.
Mm-hmm.
But up to date, up to today, the age 40 is the standard for mammogram.
All right. So when you talk about detecting new markers, I mean, we had a few years the case of Angelina Jolie. She didn't develop breast cancer, but she underwent a double
She had a family history, so she falls in the family history risk. So this is why we ask Lorena and other patients who in the family had, and if somebody in the family had breast ovarian cancer, then depending on the criteria, we recommend analyzing with a blood test to check for the mutation. If the mutation is there, then we recommend prophylactic mastectomy, prophylactic salpingo-oophorectomy if they have the mutation. It means that they have a higher risk to develop, and then their choice will be maybe to remove, to do the procedure, prophylactic procedure.
All right, thank you, Doctor. Now, Lorena, if you don't mind, will you take us on your treatment journey from diagnosis to when you were declared cancer-free? How you got through it, how you got through the nights and the days and just everything.
What it got me through all of this has been always friends and family. The support of doctors, of my closest friends. That's how I got through. If you are alone, if you don't have this support system, you can get through, but it's gonna take a lot.
Difficult.
Yes.
So how long was it since diagnosis to when you were declared cancer-free?
I was diagnosed back in June. And then
June of this year?
Yes. 1 month after I got my surgery, July 6th, will never forget. And then a month after, I started with radiation. And I just finished last Friday.
Wow. So it was
everything
this recent.
Back to back. Yes.
Everything back to back. So as her doctor, is she cancer-free now?
Yes, she's like, this is a plan. Like always, we establish a plan. So the treatment usually for breast cancer can be surgery, can be chemotherapy, can be radiotherapy, and endocrine therapy. And as we said, everybody is different. It's like the fingerprints. So we do like some biology analysis, and everybody is different. So we never compare one patient to another, even same age, same, it's completely different. And there was a plan for Lorena, so she should have only surgery, radiotherapy, endocrine therapy, and the plan is established. So we work in tumor boards, so we discuss all together, surgeon, oncologist, radiologist, pathologist, what any discipline, any specialty that is required, and we establish a plan for each patient, and we follow the plan. And definitely then we follow up the after. Like after finishing with the treatment, there will be a plan for the follow-up. It's from diagnosis to end of life. So we will be friends.
So you'll be friends for life?
For life.
Yes.
For life.
I'm glad.
Yeah. So let me ask you, at this point in time, how do you feel?
Very emotional, but very lucky.
Understandable.
That's how I can describe it.
You're stronger. You fought like a girl. So what is your message to women out there when it comes to breast cancer?
I think it's very important for us women and men to take care of our bodies, to give enough importance to our bodies, not only when we feel that something is wrong, like because in my case I didn't feel anything was wrong. I've been very active, as doctor mentioned. I've been doing boxing, running, everything that you can imagine. But one day here I was.
Yeah, you are.
So I think it's important for all of us to feel what is inside of us, to take care of us, to take a moment and to examine ourselves, because this also influences our mind. You know? When we are sick, we go down into sometimes a depression path if we don't have a support system like our friends, our families, our doctors.
Especially those of us living here in Dubai without any family.
Yes, because the tendency here is that you work, and you forget about yourself.
True.
So, yes.
Well said.
So that's the message, to take care of yourself.
Mm-hmm.
It doesn't take long to go to the doctor, to do this exam. They are not easy. I cannot lie. For me, it was very hard. Every single test, but
Mm-hmm.
it's worth it if you want to live.
Thank you. Thank you
Yeah.
so much. Thank you for finding the courage to join here today.
Of course. Thank you.
Now, doctor, in addition to being consultant oncoplastic breast surgeon, you're also the director of King's Breast Cancer Center. Tell us what you do.
Yeah, so the breast unit, so it is a teamwork between breast surgeon, breast radiologist, oncologist. So we try to get the message out there to the biggest number of patients, biggest number of women.
Mm-hmm.
Please do not forget the screening. Do not forget the early, because early detection can save lives. Please do not forget the screening at the age of 40. Do not forget the self-examination every month, because there are many, many, many examples like Lorena and even other more like not obvious examples.
Mm-hmm.
But every time when we can detect very early breast cancer, it is a gain for us.
Mm-hmm.
It will allow us to maybe not clear, but if we can eradicate in the maximum number of patients the cancer, the breast cancer, the cancer cases, this will be like a huge plus for us.
Mm-hmm.
And this is the purpose, to get the message to the biggest number of people.
Mm-hmm.
And if we get the message to mothers, daughters, sisters, then the message will go like to other more friends, to companies, to because really, really early detection can save lives. So please do not forget the screening.
Screening is very important. All right, doctor. Thank you for
Thank
joining
you.
us today.
Thank you, Lorena.
Lorena,
Thank you.
Thank you for joining us today. It was a pleasure having Dr. Rita and Lorena here. As you heard the ladies, get screened, get screened, get screened. It might save your life. Until next time, here is me signing off. Bye-bye.